Good afternoon. Good afternoon, everybody. We're just getting everybody situated and let in from the waiting room, so we'll get started here in a minute. Okay, well, I know that it's 3:30 or 3:30. I guess I'm already projecting how close we would be potentially getting to happy hour, but no, it's a Friday afternoon and it's 1:30, and a good thing that's the case because we'll have a time to get through this in presentation that we've really been looking forward to with one of CPOC's partners at Amity Foundation. They're going to walk through a lot of the rehabilitative programming and different ways that they have dealt with a lot of the same things that, frankly, probation is dealing with, and how they can partner with probation departments and others in your communities. We're really fortunate to have Doug Bond, who is the president and CEO, and he has a very extensive bio and history that is super interesting, and I'm hoping he will weave that into some of the presentation, so to give it a little bit of flavor. But really, I think it's important to know that Amity Foundation works with many counties up and down the state of California, with the state of California, with other states. And so we're interested in hearing more about how that collaboration and intersection may be of use to all of you. So thank you for joining us this afternoon. And you really came to listen to Doug and not me. So I'm going to turn it over to Doug and have you go through the presentation. And I'm happy to help with the chat and to take questions. I know Doug was hoping to have some interaction, so please feel free to raise your hand if you want to ask a question, or it may just be easier to pop something into the chat and we can move it into a break or a natural place to kind of have that discussion. So with that, we'll turn it over to Doug.
Thank you, Karen, and thank you, CPOC, for having Amity Foundation join all of you today. Really appreciate all the probation departments that made time to be here. As Karen mentioned, my name's Doug Bond. I'm the president and CEO of Amity Foundation. Amity Foundation's been providing services to justice-involved individuals for over 40 years. We're probably one of the larger community-based organizations that work with justice-involved individuals in the Western United States. A little bit about my background history with Amity Foundation. I actually came to Amity Foundation in 1983. The founders of the organization got me out of foster care. I had a judge that really believed in family reunification. My father was incarcerated, my mother was incarcerated, and I spent time in about a dozen foster homes growing up, and spent a lot of time visiting my parents in and out of incarceration. I spent 2 years at Amity Foundation after the judge allowed me to reunite with my father. Was one of the first children to live with their father in a residential treatment setting. This is back in Tucson, Arizona. And my father's probation officer was my baseball coach, so he got some extra supervision, and I had a great pitching coach and baseball coach that was somebody I stayed in touch with and still in touch with today. The judge that helped me and my family, I also stayed in touch with throughout his life. And so I got to see what could be possible when many folks wrap their arms around families and communities that are impacted by incarceration. I think that influenced a lot of my life. In my 20s, I came back to Amity and could have easily ended up in a lot of situations. They really helped me out, supported me in my 20s. It was about 2007. During the middle of realignment, and I saw how fragile community-based orgs were in terms of resources. work to help develop a lot of our employment services department, a housing department. We did really good treatment with individuals, but people weren't able to get jobs and housing. And I didn't frankly think that was good outcome for individuals after we invested a lot with them in treatment. And so now we have comprehensive services in all of the areas, which I'll present on today, and really do believe in a participant-centered approach. We work with justice partners in many, many settings and really feel like these are collaborative relationships that really help lead to long-term successful recidivism reduction and public safety. So I'm going to ask Desiree to pull up the slides so we can go over some of our services that we offer. And so when you Amity services, we do provide a lot of services, but I'll break them up into a few. We do substance abuse treatment, and that started with therapeutic communities. We actually did a lot of the research on the in-prison and in-jail therapeutic communities. We did the first jail project in Pieman County Jail in 1986, which led to the first in-prison therapeutic community at R.J. Donovan in San Diego in 1989. We provide cognitive behavioral treatments. We provide case management, enhanced care management, which I know a lot of counties are working on right now with CalAIM. We did a lot of the precursor work to that, a lot of the evaluation about 12 years ago on these services. And we provide transitional housing, and then we develop and operate permanent support housing. Next slide. So Amity Foundation is dedicated to the inclusion and rehabilitation of individuals that have been marginalized by addiction, trauma, criminality, incarceration, poverty, racism, sexism, homelessness, and violence. We strive to improve health, promote environmental, social, and economic justice. Amity is committed to research, development, implementation, and dissemination of information regarding community building. We provide support to groups all over the world, actually. We just had Honduras here. We do a lot of work with the State Department. We inform other states on the services that we're doing. We freely share anything that we're doing as a community-based org to help uplift and support communities, not only in the United States, but around the world. Next slide. I just want to give just a brief insight of the impact of Amity services. So the first slide you'll see are a lot of our Amity services that are more community-based. A lot of this is Southern California based. We're expanding that right now. We're building a campus in Sacramento. We're building another one in Alameda that we're working on as well, one in Riverside. We operate about 1,000 residential beds in the community, and we serve thousands of individual in our community-based settings. We fund Department of Labor services in many of the counties throughout Southern California, and are really working on expanding those services throughout Central and Northern California. We're one of the largest treatment providers for in-prison services for individuals that are coming home on post-release community supervision. We operate in 21 prisons. It's a little over 80 prison yards. We have about 650 staff that go in every day and do treatment services and cognitive behavioral services in the MAT substance abuse treatment programs throughout the state of California in the prison settings. And then the last map that I'll show you is our enhanced care management services. We've gone into contract with Kaiser for 32 counties. We're implementing phase 1 right now. And we're helping to expand those services throughout the state, both as a direct service provider, but also helping as a third-party administrator to other community-based orgs. Next slide. So our in-custody
If I
work.
could stop you. Oh, just really quickly, there was a question in the chat that I think kind of touches on the last slide. Is there any interest in moving into rural areas that maybe already lack community-based organizations? Are you doing any work in that?
We are. So part of the expansion that we're doing right now is to make sure when you see the last map there on ECM is if you see the blue areas, we're really trying to expand out to many of the rural counties and areas in California. We also want to help other community-based orgs that may already be in those areas, but don't have the infrastructure and resources. And we do that a lot right now. I'll talk a little about it a little bit later, but we help do grant making and technical assistance and capacity building for about 600 community-based orgs. There's a lot of great community-based orgs out there that really do good work, but don't have the administrative infrastructure in place. They don't have all the operational infrastructure in place. And so we're definitely interested in expanding to rural counties and then uplifting the groups that are actually may already be in some of those counties to build their capacity as well.
Great, thank you.
And our in custody work is, I went through this with our in prison. We've been doing jail and prison release planning and coordination of care for 4+ decades. This is something that we really believe a lot of our work starts both in custody, obviously in the community. I'd love to do more prevention, and we're doing a lot of that with our youth work, but a lot of our treatment services for individuals that are exiting incarceration starts inside. We build the relationship with them, we start the treatment services with them, and then that continues on into the community. And whether that's directly with us or with groups that we support, with our resources, we want to make sure that there's a seamless continuum of care that goes from the inside in custody jail settings, prison settings, back to community-based settings. We're one of the founding organizations, as I mentioned, around therapeutic communities. We've been doing that work for a very long time. You know, a lot of that work has evolved over the years, so really getting up to current practices. And I'm on the board of National Institute of Health with JCOIN, which involves National Sheriff's Association, DA Association, and works with probation departments around the United States. We really try to inform better practices for work with justice involved individuals and make sure that probation departments have all the support from community-based organization. And as I mentioned, we serve several thousands of individuals that are justice involved each year. Next slide. Let me go over the coordination of care services that we provide. So we subcontract right now with about 42 different community-based orgs and 102 locations. And this is a program that we provide for individuals that are returning out of incarceration in state prisons. We provide licensed substance use disorder detoxification services. We provide licensed residential treatment services. The Female Offender Treatment Employment Programs, an 18-month program for women with their children. And then we provide reentry recovery housing. So after they've gone through treatment, we want to make sure that they have safe and stable, both interim and permanent housing supporting settings. And then we couple that with outpatient services and making sure that they have the full continuum of care. So we don't want just people in housing without outpatient or without comprehensive case management services that help support them. And this is a model that there's about 6 regions throughout the state. We oversee one of the larger regions for this as well. And this is something that we're trying to expand through CalAIM and other Medi-Cal models. I think that will really enhance some of the services for this and better leveraging Medicaid services in the community. Next slide. So a little bit of the coordination of care continued. We actually work closely with parole or probation, provide case management, screening and assessment, community resource coordination for employment services. This particular program, we actually do the transportation from in-custody settings to community-based settings and make sure that people are safely transported from incarceration to community-based services, which is such an important element in making sure that people don't drop off by just getting a bus ride home, and they have safe transportation and placement. We've done a lot of research on the impact of this as well, making sure that people get home safe. And then we work with parole service advocates on the inside and work with their placement in the community. We actually do this with both probation and parole with self-referrals. We've leveraged a lot of philanthropy funds on this during the pandemic, and I'll talk about it a little bit later. We initiated a program called Returning Home Well, where we raised about $15 million to help with the early releases that were coming home to support probation departments. And CPOC was incredible in this effort, and many of probation departments, and making sure that resources were in place. And we served as a funding agency and coordinating agency to make sure that supportive services were being done for individuals that were returning home. Next slide. And so enhanced care management, I'm sure many of you are familiar with what's going on with the CalAIM initiative. A lot of this work actually started with some jail-based projects that were serving high utilizers that were frequently going out in and out of county jails, had more than 5 incarcerations a year, and were chronically homeless. These were the high-cost utilizers for most counties, and so we identified this group. We got grant funding from the Hilton Foundation and from United Care, and did a pilot initiative on this over a decade ago, and it was very successful. We, of course, reduced the costs of services for individuals in the community. A lot of that was a precursor to CalAIM and enhanced care management. Now you're seeing this at scale in many of the counties throughout the state. I know that we're starting a lot of that work inside jails and moving into the community. We've activated a lot of those services now, and we're starting hiring and ramp up for the counties that we're both starting the pilot in, but want to move into the 32 counties, and you'll see the list of those counties. We hope to move beyond that. Our contract initially started with Kaiser, which has 32 counties, but again, really want to expand after we've been able to implement and test the program. Community sports include things like housing transition, navigation services, housing deposits, housing tenancy, and sustaining services for the adult justice involved population. I will say, because I do a lot of work on the national level with these 1115 waivers, is that we're looking at including, hopefully in the next waiver, which is 2 years from now, things like more interim housing. So building in 6 months of interim housing for individuals that are just involved, which will help with probation departments and the supportive housing services that folks need. As we know, there's a huge shortage of housing in the community, and that will be hopefully something that can be woven into this Medi-Cal waiver in the next version. Currently, we're rolling out services in LA, San Bernardino, Riverside, and Orange. This is where we're just starting out and testing. We've already brought on all the staffing, electronic health record systems. We're doing all the inReach right now through telehealth into the prisons. And we've actually started taking our first set of placements this week. So we'll be successfully placing those individuals back, coordinating with probation departments and supporting their services in their local communities. As we continue to grow, we want to include San Diego, Sacramento, Santa Clara, Kern, and Alameda. We have a phased program schedule for every one of 32 counties, and we're happy to share that with the group if that would be helpful. Next slide. And here is the
I guess
list.
you're
Yeah.
Oh, sorry. I was just going to say, it sounds like you're covering one of the questions that was being asked in the chat, which is CalAIM. So that's really good. But on the enhanced care management side of it in the counties that you're working in, this is, you said through a contract with Kaiser. So like they're the health plan serving those counties. And so you're connecting first there. And then are you doing any coordination with probation or other justice agencies in those counties to one of the things we've been really struggling with at CalAIM is trying to make sure that the things that we're supposed to be doing with our work related to all the individuals where there's overlap, that's great. But am I glitching? Sorry.
I can hear you perfectly.
Oh, okay. All right. Sorry about that. So yes, so just, continuing to talk about CalAIM will be, I think, of great interest to us here. So.
Yeah, I think this is where we would really appreciate all the support and collaboration with probation. We want to help complement any of the needs that you have in your counties. And so we started out with Kaiser as a managed care plan, the first managed care plan. The way it works with the managed care plans is that once you're activated with one managed care plan, you have to contract with every managed care plan for the county. So we just went into contract with Molina. We're working with the local health plans in each and every county. We're working on other health plans as well with HealthNet and others. And so eventually we'll be contracted with all the managed care plans that cover each one of these counties. That is a phased process that we're going through right now. And I have a pretty significant sized contracts team and services team that's working on the implementation for that. For every one of the counties that we're in, we absolutely want to make sure that we're partnering very closely with probation. So we're coordinating on the services that we're providing and communicating very closely with probation on what their needs are and making sure that we're not duplicating any of the services. We're also working with the local health services agencies in every one of the counties that we're in. And so typically what we'll do in any county is, because there's so many county departments that this will overlap with, is that first we want to connect with our probation departments and justice partners, with the health services in those organ areas, and then with housing, employment services, and other supportive agencies, and serve as a coordinating organization to help support the needs of folks on supervision. And Karen, was there another part of that question?
It looks like there's a follow-up as to why maybe some of the counties aren't on this list.
Yeah, so if there's not a county on this list, it's because of the bid process with the managed care plans, and because we went into contract with Kaiser. Kaiser had a state contract with Department of Health Services for 32 counties. As we enter into contracts with other managed care plans, those managed care plans will have contracts in other counties like El Dorado and other locations. And so we're working on the expansion of what we're doing in a phased approach. The first was just to overlap with all the areas that Kaiser was in, but that's the ultimate goal, is that as we get into other counties, say we get into with Molina or another health plan, we'll expand that as well. So we hope by the end of the year, this will actually increase. And we're doing overlapping mapping on the different services that each health plan provides. There's a lot of coordination that goes into all that, as well, as you could imagine. Next slide. Returning home well. And so I will say, if any counties have questions about ECM, we'll provide our information at the end. We definitely want to meet with you. We want to be partners with you on this. We want to help support your efforts on this, and we understand how critically important probation departments are. We're typically used to being able to co-locate with probation departments, be on call with probation departments. We have 24 hours that we know that we have to respond. We know that the needs don't just happen between 9 and 5. We've been doing this for quite a long time. We're perfectly comfortable in co-locating in settings that you would like us to be at, working remotely to make sure that we're going and picking up people and getting them in our services. And it's something that we really believe that our probation partners are a big part of in each one and every one of these communities. And we'll provide more information to all the folks on our team that are helping to roll this out, so we can continue any conversations on this. Anything that we've learned from bringing on our electronic health record systems, our quality assurance systems, our service delivery systems. There's been a lot of investment that we've done over the last year to really make sure that this program is successful. And I'll just outline a little bit of what we do with public-private partnerships. This is something that you'll see is really expanding both in California and, frankly, in many states across the United States. We've had conversations with Idaho, Nevada, Arizona, many other places that are talking about leveraging public-private partnerships. We are well-versed in this. We do a lot of work with philanthropy. And we're able to mix or add the philanthropy funds to whatever funds are locally sourced from government agencies and maximize services. Just as an example, during the pandemic, which I know was a strain on a lot of groups, I know for us, it really tested our bandwidth and our organization's ability to serve individuals, but we activated hundreds of community-based orgs. We were able to raise $13+ million. Actually, it was a lot more than that when you get into other supportive services, but stipends and other things for treatment were all raised by philanthropy. We placed about 5,000 people into reentry housing. We activated 200 community-based providers across the entire state of California, and then made sure that thousands of individuals got rides home, meals, and expanded daily reentry capacity by about 1,200 people throughout the state of California. And I will say that this was not Amity Foundation doing all of this. This was partnerships with all of the counties. Many are represented on this call, and many groups coming together in a very trying time, which I know that we've all, been through, but it really showed what could happen with public-private partnerships and when local businesses and communities and philanthropy really steps up to help support and leverage other resources. Next slide. And so Circle Tree Ranch, I'll just mention, this is when I talked earlier about my own personal story. We had a ranch across the street called Desert Willow. When my mom came home in 1986, she actually went to this ranch that we have. It's a 65-acre ranch, beautiful property, used to be the Westinghouse property. We work a lot of folks that have dual diagnosis and co-occurring disorders for treatment. We work with about 22 tribal nations throughout the United States. Work a lot with their attorney generals and their justice systems, and so their tribal courts send a lot of placements. We work with federal probation, work with local probation, and many of the state county probation departments throughout Arizona for placements at this ranch. Really an ideal setting. We're able to have men, women, and children there. So we have 65 acres and 42 buildings. I wish I had this in many other places in the community, but it's what we would want to do for healing communities for people that are coming home. We do things like mindfulness. We do a lot of family reunification. I really believe that if we invest in people that are coming home and create better supports for them, that their children will be impacted too. And I've been able to, experience that personally, what I've gone through. And then also my children and their children will be impacted by that as well. We provided effective addiction treatment services on the campus for many years and really use this as a testing site of doing some of the innovative services that we do throughout the country today or throughout all of our areas of care. And then we do training on this site. So places from around the country and around the world send teams out to do training for services. We host a lot of gatherings there with our justice partners as well. A lot of training retreats for individuals. We're getting ready to host some trainings as well with the sheriff's department there and probation. And it's a good place that we're able to really provide comprehensive care. Next slide. And if you ever
One of the question.
Yeah.
Oh, sorry.
Go ahead.
I think we have a delay. It's probably on my end. My internet service obviously is faltering a bit, but I did want to stop here to ask you to, as you're going through the presentation, because you have noted that you already do partner with probation, whether it's in Arizona as here or in California. It may be helpful to this group, and it was noted in the chat, to maybe be a little more specific about what that work looks like for the interaction with probation, so they can kind of think through how that might work in their counties.
Yeah, it's a really good question. So we work with probation departments on placement for individuals. We have drug treatment alternative program. I'll just mention the one that we do in Arizona. I can mention examples here, where we actually have a direct contract with the county and the probation department. And so anytime they have an individual that's under probation supervision and they're testing dirty for substances, they're in need of residential care or behavioral health care services, we work in partnership with probation to make sure that we take their call, we do a placement right away, we do an assessment of that individual, and then we get them into whether it's outpatient or residential services with us very quickly. And so whether that's a coordinated release or somebody that's dropping into the probation office, we work side by side with probation. We also do reporting for them. So if they need weekly testing, if they need any reports for the court, if they need anything for supervision, we help work with probation departments to make sure that that's provided. We also make sure that they have access to employment services, access to housing as well, and then coordinate their care with any family reunification services. So we really work with any of the conditions of probation that they may have or their case management plan with a probation officer to ensure that all of those services are taking place. I'll say the other contract that we work with is with San Diego Probation. and we've been providing services in San Diego since 1989. We've done a lot of work with them. We provide residential care for probation, the probation department there. We have a 4-acre ranch in North County that we've had since 1994. And we've been doing a lot of services very similar to that, where again, we provide access to residential care if they need it, transportation, employment services, and then access to permanent housing placement in the community. So we really work as a partner with probation departments to make sure what are the needs that they're going to know through their assessments, and then what support do they need from us. And we manage about 67 contracts that are federal, local, and state, in addition to the philanthropy resources that we have. And so we have a wide range of services that we either do directly or that we connect with other community-based orgs for. So a lot of times with probation departments, we want to be a thought partner, we want to be a services partner, and want to make sure that if there's a need for services in the community, that we're either helping to provide that directly or we're connecting you with a group that can provide that directly.
Thank you. There's also a specific question about the program you were just talking about. Do they admit clients from other states?
They do. Yeah, we actually have clients from throughout the country there. We have folks from Alaska, North Dakota, Washington, you name it. We work with folks from all over, and we've worked with court systems from all over the country, actually at the ranch, to take individuals. A lot of times people need a change in location, especially with their children, and we don't just accept the mother. We'll accept the mother with all 4 kids. We're not going to have them make Sophie's choice and just bring one child with them. We've had mothers and fathers, and we have enough property there, and the space is separated out enough that we're able to take entire families in there. And so it's been a great model, I will say. There's a lot of times when people actually are able to get stable at this location, and then we help with a transition plan back home for that individual as well. And we work with the probation department if they're on supervision with interstate compacts, things like that, whatever's needed to make sure that that person's transportation and coordination with supervision is done seamlessly. And I will jump to the next slide, which is talking about some of our community correctional reentry centers. And these are our campuses that allow people to serve the last 6 to 24 months of their sentence. And they're technically in custody. They're called the Male Community Reentry Program and Female Community Reentry Program. These are folks that are going to transition home on both PRCS and parole. So people that are doing well inside of the prison system and have demonstrated motivation for change are able to apply for these programs. We're seeing a lot of success with these programs, about a 92% reduction in recidivism, at least in the first year. And we're doing 3- and 5-year studies now for individuals that have spent 9 months in the program or more. And these are licensed residential treatment facilities. Folks are able to go out and get healthcare in the community. They're able to get work in the community. They're able to get treatment, behavioral health services, and primary healthcare. We work closely with corrections. We have a corrections officer on site. We have a parole agent on site. We actually have probation officers that come on site and meet with the individuals that will return home once they're placed in their under supervision. And so these are, extremely successful programs. Would welcome a tour from any of you if you'd like to see these. These are ones that we're trying to start in different areas throughout the state. When I mentioned the campus in Sacramento, it's one that we're building up there, working on one in Alameda and one in San Bernardino and Riverside, and really see these as a successful way of allowing people to come home safely back into the community, and with the support of probation departments to make sure that they get the care that they need. They're on an ankle monitor. There is supervision. There's a lot of security features that are very discreet there, but are in place for public safety needs. And then we make sure that we work very closely with probation and other partners to coordinate their care back home. And I see a few questions in the chat, so I'll pause for a moment.
That's great. Yeah, you're definitely hitting on areas of interest for folks. So that's great. Well, I know you're going to talk a little bit more about also some of the your youth programs or your transition age youth program. So I know there's a few questions there, but before leaving some of where you are right now, are the programs that you work on solely targeted towards justice involved individuals or services provided to other marginalized populations?
So their services are, we're known for a lot of our work with just involved individuals, but we work with a lot of marginalized populations and individuals. We do a lot of work in homeless services. We actually do a lot of work in youth services. I'd love to see us get more front end. We're really avoiding waiting until people end up in prison to provide a lot of the support that they need. We really should be doing that earlier on. And so really are invested in that as an organization. We do a lot with tribal communities, as I mentioned. And then we do a lot of substance abuse treatment, which doesn't necessarily mean that the individual has to be just involved, but we want to make sure that we're serving the communities of need of marginalized individuals. So that's a really good question. And then there's a lot of areas that we may not do direct services on, but we partner with other great organizations. One thing we've learned as an organization is do what we do well and partner with groups that do what they do well. I'll give you an example with federally qualified health centers. We're not a federally qualified health center or clinic, but we embed those services into our service delivery model. So we make sure that we get the benefit of a federally qualified health center. Charter schools is another example. We're not a charter school, but we've partnered with groups like Five Keys and other great charter schools to make sure that those services are available for the individuals that we serve. We also have a lot of partnership with the community colleges and the UC and Cal system, and really see a lot more of our folks getting that pathway to education. I'll give you an example of something that has really been helpful for us. One of the barriers, as many of us know, FAFSA applications are very difficult to fill out for anybody. As a parent with a 20-year-old, I'll say that it's challenging for any person that has to fill it out. And that was a big challenge for our youth and our adults that were coming home. So now we have FAFSA experts that help them with that application process. And our college enrollment rates have gone up through the roof. It's being able to address barriers like that. And that's not a funded resource that we have with any of our contracts, but we were able to raise philanthropy funds to provide that support. And it says, where is the Sacramento going to be located? It is on, I believe, 57th and Stockton, and that's going to be in partnership with a group called WellSpace. And so they're a federally qualified health center. Jonathan Porteous, who runs WellSpace, a dear friend, and I've worked with him for a long time. We're going to be doing they're going to be doing a full-on clinic, medical care there, an employment center, and then we're going to run the residential reentry campus there. And those are the kind of partnerships that we want. And then I'll answer the question actually, because it's a good one, with the DJJ and CYA. Before the transition of DJJ, we actually operated all of the treatment services in every one of the DJJ facilities. We helped with a lot of the resources for DJJ services as they transition that home. We do have some pilot programs that we've done with step down, and we're very interested in working with probation departments on this. Really want to make sure that these services are done well. We have a lot of experience in doing this, but know how complex the needs are for this population. We also know the benefits of a lot of individuals that have done time and kind of been there, done that, mentoring those that have been youth that are in these step down facilities. So there's a lot of interesting dynamics with, say, lifers or folks that have done 25 years or more that have helped in terms of mentorship and are very credible messengers to them. And so we have a complement of both lived and learned workforce that help with those facilities. And we actually, it's called our Young Lions Project, and, you know, very supportive and very interested. I'm doing a fellowship right now with Durfee Foundation for Stanton Fellowship and looking at different models actually around the country, and have been able to spend time looking at various models that are doing step down services. just looking at one that was a facility that was shut down. That was a former juvenile justice facility and is converted into a step down facility. And so we're very, very interested in working on those solutions. And we've also figured out how to do a youth track within these adult facilities. Those are typically from 18 to 30, and really have been able to move a lot of the funding to up to 30, because a lot of youth that are coming home, frankly, at 24, to draw the line there, we really need to think about how we define youth back in the communities, and the support that they get when they come home. So that's a really good question. And anything that folks have questions on with that, please email myself and Desiree. We have a whole team of people that work on that project alone. And we'll get into some of that as well, because we also have, I believe, a 9-county pilot that we're rolling out right now for employment services with OICR, and with many of the probation departments that are going to be a part of that. Next slide. So I just want to share a little bit about our physical environments. We've been able to do a lot with converting. We do the same thing with environments that we do with people. We take a lot of distressed properties, and we really want to improve properties. I really believe in making sure that environments reflect the emotional environment that we're trying to set, and the physical environment always represents that. The campus that you see here was a work furlough that we were able to purchase. The courtyard that you're looking at there was actually a parking lot. In many areas, everyone loves what we do. They just don't want it in their neighborhood. And so we are able to work on a lot of the complex siting for locations, and making sure that we're a good neighbor to folks too. We want our buildings to be beautiful, and we want to improve the neighborhoods that we're in and the communities that we're in. And we've often done that in some of the most distressed neighborhoods and communities. If you come into any one of our environments, they are not, a flop house where you see no paintings on the wall or really bad environments. We go to great lengths to make sure that the people in the environments, that our workforce, and that we call our participant students, really have a good environment. You see less incidents when you set a nice environment up for people. The other thing that we do is food. We don't just provide cheap food for individuals. We provide very quality food. It's not hard to make us happy with good food. And there's a lot of health indicators that show that hypertension, diabetes, a lot of things can be addressed with diet. So we go to great lengths to make sure that our culinary arts department provides good meals to the individuals that we serve. Next slide. And a lot of times those things really make a difference in somebody's experience. It's one less thing to worry about when they're working on all the emotional needs that they have to, all the treatment needs, all the family unification, and all the anxiety of being back home in the community. This is an example of we're doing an $11 million renovation. We did a capital campaign project on a building that's about 100 years old, that we have 184 beds in right now. And, it's a labor of love. Rather than doing one room at a time and starting all over by the time you finish, we're doing it stack by stack. The people that work on our buildings actually are participants as well. So they're able to work with the contractors. They're able to get trained at the community colleges and get good prevailing wage jobs back in the community. So we're able to pay people. We don't pay them directly on this. Our contractors on the projects really believe in the work that we're doing, and it helps having people that have been formally impacted and have gone through these projects working on the buildings. People take a sense of proprietorship when they've actually invested in the environment of the campuses. Next slide. And we're doing more and more of that now. I will share some of I already talked about Return Home Well. The other projects that you see on here is that we're getting a lot more invested in permanent supportive housing. I will say we're not a developer, we co-develop. And the reason that we started co-developing is it's really hard to say that you're not going to help house our folks when you're an owner and a co-developer. We don't want to be a developer. We work with great developers that do what they do best. But we do want to be invested in housing, because a lot of folks in the community have set up a lot of barriers to house individuals. And if we invest all of this money into treatment, education, employment, and the end goal for that individual is going to a shelter, then we failed. And so we have rental assistance programs that pay people's rent for 6 months. Oftentimes, people don't need deeply subsidized rent for the rest of their life. It is a smaller group of high need individuals that really need that level of care. The average person that is working with probation or coming home out of incarceration may just need help with 6 months to a year of rent. And we've been able to do this successfully with raising funds, and hopefully we'll build that into things like Medicaid waivers. And then we ask them to save a portion of the rent that we paid for them. And so they're building up savings. The other programs that I mentioned, we actually require a 75% savings. We pay for absolutely everything. I always tell our students that I would save 100%. All of us that are out in the community don't have the luxury of not paying bills. And so save your money while you can, because bills and taxes will always be there for us when they come home. And a lot of these folks are getting really good livable wage jobs. And we're setting up the conditions where they're not going to want to commit another crime and go back to incarceration. Next slide. I'll talk about our youth employment initiative and just talk about employment in general. Very few organizations specialize in employment services for for individuals that are on probation supervision. And one of the reasons for that, I won't go down too many policy roads with everyone right now, but Department of Labor sets goals for 90% placement rates. And so if you're going from job A to job B, that is typically what those funding sources are there to serve. A lot of folks that are coming home and that are on probation or supervision have never had job A. And so it really hurts the employment services departments that provide the services to just involved individuals when they're not getting people from job A to job B because they have to hit that high placement rate. In my opinion, and we've been a big advocate for this, where you really get a return on investment is really serving deeply targeted and high need individuals that really need all the support to get their oftentimes first job and build that. This is a partnership that we're working on right now with the Office of Youth and Community Restoration and the Department of Rehabilitation and probation departments. So and it's a $30 million joint partnership where we're actually going and funding some of the community-based organizations in these 9 counties. And this is with Contra Costa, Imperial, Kern, Lake, Sacramento, San Mateo, Solano, San Benito, and Riverside. And this will be entirely focused on the SYTF youth or probation youth that probation departments are serving in their camps or juvenile justice settings. And these are youth with disabilities, and they often face significant challenges. And when you think of disabilities, it's both behavioral health and physical health. It's not just physical disabilities. There's a lot of folks with substance abuse, which is a disability as well, or other behavioral health needs. They often end up in justice systems without the proper support. So understanding that the probation departments are often working with individuals that didn't get the support that they needed in the community before they were under supervision. And now we're getting them the support that they need with your partnership. And approximately 28% to 43% of detained and incarcerated youth require special education services. So we're going to be helping to coordinate a lot of this in partnership with the Department of Rehab. We have a whole team of employment service experts that are the best in their spaces. We've done a good job of recruiting former heads of workforce departments and counties and cities to help us with this project. And then we have an incredible employment services team that is specialized in providing services with occupational therapists, business service reps, employment service reps. And we really did this because a lot of the employment service groups that we were working with, and I think there's a lot of great groups out there, but they didn't really fully understand the needs of individuals that were under supervision and all the coordination that needs to go on with a probation department as well. And so really feel like this is a area that we really are able to stand above the rest and do very specific services. And we've been able to create support on the federal level for specific funding services for this population and on the state level. Next slide.
Can you just, and this may help answer some of what I think are natural questions for a lot of probation departments as they're looking at different ways to blend funding, and where there is definitely areas that people are already working on, things that we can kind of combine and collaborate with. So for this one, you have it as a 30 million joint partnership. Is that 30 million from, for example, a grant from OICR, or is it 30 million of kind of pull down funds from the Department of Rehabilitation? Or is that your, or the individual counties that are going to be involved, are they also pitching into that 30 million? Can you explain a little bit how that works?
Yeah, it's a really good question. So the 30 million is a joint partnership from the state through OICR, and part of those funds will go directly to probation departments. OICR contracts directly with probation departments that are participating. The other resources that are part of that 30 million will go to community-based service providers, and then we serve as a coordinating agency. The Department of Rehab funds are not calculated in that. That will be an additional drawdown. And then we're bringing in other resources. We're in conversations with the Schultz family, with Starbucks, and other community philanthropy organizations to bring in additional funds, because we know that there's going to be gaps and needs. And I know that there's a question about out-of-pocket expenses. There are always out-of-pocket expenses, but we never charge out-of-pocket expenses to the participants. It is my job and our organization's job to raise monies to make sure that individuals don't have to pay for the services that they're being provided. And I feel very passionate about that. We often work with counties and states and federal governments to make sure that people are able to get from A to Z the full range of resources. That's why we have so many lines of funding, is that it's often complex of getting the true needs for individuals. It should not be the burden of the individual to figure out how they're paying for all of these services, but my team is very good at weaving the service needs from everything from treatment to employment to housing. And so if folks want more details on this particular project, we're happy to share. There's also a press release that was just done. I think the OICR release as well. Part of the resources were to make sure that probation directly had support to help the coordination on this project. And we really believe that this will be helpful. Department of Rehab, we've been a vendor with for some time now, and it's able to pay for things like education, equipment and tools. It has really been, any of the specialized training that individuals need, and most folks that have a disability, which includes substance abuse, behavioral health needs, have been able to qualify for DOR resources. And those are available in every one of the counties throughout the state. And is something I would look for folks that are vendors for DOR. It's an incredible resource that frankly counties don't have to pay for. And let me see. Are these services utilized through OICR? And then the next question, are you having utilized COC funds, secure housing facilities? Yeah, so on the housing side, we do leverage COC funds. I will mention, permanent supportive housing is one of the most complex funding structures. We get funding from federal, state, local. It is a lot that goes into those projects. We have about 1,000 units that we're under development on in one phase or another. And again, we're not the lead on it. We have enough information that we're a co-developer and able to see some of the complexities, which allows me and others that help shape policy on the national level to really figure out, why are we making it so complex? Why does it take so long to build affordable housing? And why a lot of times, and I don't know if everyone's aware on this call, one of the things that I advocate a lot for in DC is that if you're in jail or prison or in treatment for longer than 90 days, you're not considered homeless. Even though you were homeless when you went into jail, or you're homeless when you went into prison or a treatment facility, because you're in an institutional setting for more than 90 days, you're considered housed, which is one of the biggest barriers to homelessness for just involved individuals, I believe, and a fix that we have to do at the HUD level. and something that we're advocating for quite a bit. Next slide. Prison employment and housing. So this is another example of a collaboration that we were a statewide program. These went out to counties throughout the state of California. We worked in collaboration with workforce investment boards and collaboration with community-based providers, worked with education coordination, so local community colleges, Project Rebound with Cal State. This was one that we actually signed off that we would not take any funds for, so we could distribute this out to our network of providers, and we served as a coordinating agency with the workforce departments. And for us as an organization, I will say that we're very selective of the programs that we pick, and we want to make sure that we're doing good work. We're a nonprofit organization, so as long as we're covering our costs on a program, our goal is not a profit-driven goal, it's an outcomes-driven goal. And so we want to make sure that our folks have livable wages, job retention, vocational training. This was a precursor to a lot of programs like Hire and other programs that really showed that we need to focus on employment services for a just involved population. And I think I mentioned some of the housing on here. The slide's an older slide. We're actually in pre-development on many more units right now. We're doing a lot of work with the Board of State Community Corrections on rental assistance and help create the adult reentry grants in partnership with the state to make sure that the counties had warm handoff dollars and that they had rental assistance dollars for housing supports. And then to the question earlier about COCs, we collaborate with coordinated entry systems, which is in collaboration with COCs, and really see successful outcomes when people have treatment, employment, or income and housing. And not to oversimplify it, there's many other things that are needed in there, but really believe in those three core services and then wrapping all the other necessary ancillary services around them. Next slide. And then we have, the other thing I'll mention on employment services, we often work with Department of Labor now as a third-party administrator to fund other services for just involved individuals in the counties, and are making sure that federal resources are being allocated to counties in California for probation departments and for parole departments to make sure that they're getting the support that they need for just involved individuals coming home. Our employment services department offers 12 grants, and these are, provide trainings, education, earn to learn programs. We work in partnership with groups like Five Keys Charters, and we provide, this is just a few of the tracks that we provide: logistics, social services. We have a very good program where individuals that are just involved are getting licenses, treatment counselors in the community, substance use disorder treatment counselors, and as case managers. So we're actually able to hire them on programs like ECM, and they actually do extremely well with our community health worker programs. Construction or MC3, and again, try to create ecosystems so they're actually getting a lot of the jobs on our housing and construction projects. Welding, ventilation, AC, HVAC, apartment maintenance. We actually work with the National Apartment Association to help fund a program that trains apartment maintenance technicians. Transportation, and then we also make sure that individuals are getting often support while they're going to school so they can fast track their training and not have to work full-time and go to school full-time. And we found that to be very successful in the completion of programs and getting people into livable wage jobs. All jobs are great to have, and everyone's first job is not going to be their ideal job, but we really want to get people into a family sustainable wage level career. Next slide. And then I'll just, I think we talked about a lot of this, work with a lot of county workforce departments, want to make sure that we're coordinating with the local workforce centers, the LA job centers in LA. And a lot of this was started in LA, but we're really moving this out to other communities. I really believe that workforce is one of the most important areas, and often an area that counties can get resources from state and federal governments for. Next slide. And then I'll just mention this because this is one of the things that we've done over the last few years that we're trying to replicate on the state level and in other counties and nationally. We work as a third-party administrator to help with technical assistance and resources, often for federal government, state government, or local government. Doing the contracting with smaller community-based orgs is not the ideal situation that a government agency wants to be in. So we serve as that contracting entity for government and philanthropy and actually oversee contract management. We do a lot of the oversight on data compliance, program compliance, and then we report this out to our county, state, or federal partners to make sure that they're ultimately getting all the information that they need and that the services are being done. This is an innovative project that really see philanthropy actually helping to support. So things like youth programs, employment programs, housing programs, it's about 29 different tracks. The ultimate goal of this program is to build these community-based orgs up to the place where they can contract with local county governments. And again, these are for smaller community-based orgs that typically don't have the infrastructure in place to have some of the basic needs that they can support for things like drawdown with Medi-Cal or other services in their local communities. So it's a technical assistance project. We're still building it up right now. We've awarded all these organizations and we're actually getting them to the point where they can transfer over ultimately to working with government directly. Next slide. And this is just a example of the community-based orgs and our luncheon. We're actually getting ready to do our year 3 luncheon next month. And again, this is something that's being looked at both throughout the state of California and nationally as a model. A lot of the groups that are here are well-intended groups that have a lot of infrastructure or a lot of heart for services, but not the infrastructure to deliver on all the compliance needs and all the service delivery needs that often contracts require. And we hope to change that through this Incubator Academy. Next slide. All right. And thank you for your time and really appreciate the collaboration and partnership. We really hope that we can be a partner with your counties, with your probation departments. And here's my information if you need anything as well. And I know we're going to be sending out information. My chief of staff, Desiree Acuna, is the one that keeps me on task and makes sure that all of our leadership team is responsive to all the needs of the organization. Her information will be provided as well.
Thank you so much, Doug. That is very helpful. I think, you know, just based on a lot of the questions we had in the chat, I mean, I think, like I said before, you're definitely hitting some of the areas that are occupying a lot of our minds at this point in time. So you went over a lot. I want to be sure to give folks time to ask you any questions directly, either if we didn't get it quite right from your chat, or if you have something new that you want to ask on one of the programs that was discussed, please feel free to unmute and ask now. As people are thinking, and you mentioned you know, you'll have all of the information that we'll send to the participants here. So it'll cover, like, literally if somebody's like, I really want to look at how do we secure doing something that you discussed here in a county that maybe you're not currently in. I'm assuming that is a call you guys will be able to take, and we'll have that information for folks.
Absolutely. And we have a wide range of community-based orgs that are located in all 58 counties throughout the state. So we're definitely willing to help be a partner with you in your counties and want to be a resource. So please don't hesitate to reach out with any questions in any of the areas of focus that we're in. And even if we're not in an area of service delivery that you're interested in, we often have a lot of the contacts that are doing that work.
Question in the chat, are there local contacts or an email to get connected to seek out housing near our communities?
Yeah, if you can get in touch with us, we have a whole housing coordination department, and we also work, because we did so much with many of the community-based orgs, we can put you in touch with the groups in your county to help coordinate with a local, whether it's transitional or permanent, we could help with that.
Now,
And
does Amity do, I'm trying to think through the various different programs that you covered, and I suspect you just scratched the surface, but do you provide direct services on some of these, or is it really that all-important coordination and breaking down barriers part of the process?
I'm sorry, the last part I missed there, Karen.
Sorry, are you doing any direct services, or is mainly it focused on the coordination of some of those CBOs and others doing the
Yeah,
services?
it's a really good question. We actually do a mix of both.
Okay.
The roots of the organization are grounded in direct services. It's the majority of what we do. We provide direct services for about 35,000 individuals, but we coordinate services for about another 15,000 through other community-based orgs. And so we got involved in more of the coordination of services to really help set a higher standard and be a good partner, with groups like probation and other county departments to make sure that we were setting the bar higher, for community-based orgs. But our roots are actually grounded in the majority of what we do every day is direct services, either for treatment, employment, or housing
Great.
and case management. Yeah.
Great. Is Amity working anywhere in Northern Nevada?
We are starting to actually. Funny that we're working on some projects right now that will be in Northern Nevada. And so my team, Wayne Garcia, actually, and Kathy, who's not on this, I believe they're helping with some implementation in Northern
Okay,
Nevada.
great.
So I can get some of the information, to put you in contact with folks there.
That'd be great. And if there's I think there's a range of interaction probation departments may be looking for, which could be anything from, we want to work on a project and kind of get you on contract to address all of our needs for X. But there also may be, we've got particular individuals or really tough placement we're looking for. Do you cover both of those types of requests, or how does that work?
Yeah, that's a really good question. So we have a whole, contracts and development department. So if you're looking for vendors and community-based orgs to participate in a procurement process, we would love to be included in that, for any of the contracts that your departments are putting out. We also do individual agreements, we understand that there's unique circumstances, and we work with probation departments, on individual agreements for somebody for a placement, in services for this specific need. So there are two different groups that handle that within our organization. Desiree can put you in touch with our contracts department, which we'd welcome, to be included on any of your listservs or any of your procurement processes that you have for service delivery needs. But if there's just an individual that, gosh, I'm having a hard time with this person and they need 290 housing or 288 housing and we don't have it in our area, I'm just using that as an example. We've often worked between counties and with services to be able to place that individual or support them. I can't say that there's 100% always going to be something there, but we always want to make sure that we're trying to help, support. We've always done that. And there are often times, when we can, and we have the ability to, leverage our resources. So if we have a resource that is available, if you're not able to fund something for that individual, we'll also be a thought partner to say, well, we have this and we could put them in this resource, to help with that. Hopefully that answers your question, Karen.
It does. Thank you so much. And a follow-up from the chat. Do you do any work with CSEC youth?
We don't. But we can coordinate with folks at New Ways to Work who works with us. And if you could tell me the full acronym of CSEC, because I'm not familiar with that acronym.
I'm going to put Andrew on the spot since he's asked his allotment of questions today.
Thanks, Karen. Appreciate it. It's basically sexually exploited, trafficked children.
Okay. We work with groups that do this work in the community, and we actually help fund some of the groups that do this work in the community. And so this is an example of work that we would not do directly, but would put you in touch with groups that do really good work in this space. And thank you for
Exactly, right?
a lot of acronyms. That was one I was not familiar with. So thank you.
There are too many acronyms, as we know, in our justice space, but we do live off of them, that is for sure. I'm wondering too, kind of going back to the CalAIM work, this is an emerging area. I know a lot of our folks, like I said, are trying to kind of see how best to manage a very, what at times seems like unmanageable space. And you obviously are trying to kind of crack a lot of those same codes. One thing that I know has been of great concern is once we get going on CalAIM and just kind of the auditing that will obviously come from the state and the feds around whatever work we are setting up doing. Is that something that with all the work you're setting up with ECMs, is that something that kind of is a part of your work? Meaning, you are helping monitor and ensure that some of these CBOs that you may be working with are meeting the needs and the contractual requirements of whatever the program is?
So I will say for the ECM work that we will be doing directly, we are talking with the state with managed care plans about being a third party on this. Right now, we're set up to make sure that if anything comes to us, if probation departments are referring individuals to us or they need support with us, we will handle everything from A to Z for enhanced care management, compliance, data entry. If anything goes wrong with the state or federal government, we're the group that's responsible for that. We are looking at helping other community-based groups with that. It gets complex on this particular area. There are some organizations that are entirely set up to do nothing but the back end and administrative work for ECM, and we could put you in touch with those groups. But for anything that we do directly in those counties, we build all that out. It would not be the responsibility of probation to worry about the compliance for CalAIM and enhanced care management. And that is something that we're willing to make sure that we disclose. We want to be good partners. We're always sharing information with county partners on this. But we want to make sure that we take the responsibility of that. And so it would typically be our role to help make sure that all those things, and we're used to doing this because we've done a lot of Medi-Cal work with both county, state, and federal compliance requirements. But a lot of folks are trying to figure this out right now. I was just on the phone last night with a group that's actually working on that with the smaller community-based orgs, and we're trying to be a good partner and support them as well, because this is a perfect example of an area where folks do really good work, but once you get into medical code billing, medical compliance for managed care plans, it really can get complex, and we don't want to lose the capacity of small community-based orgs because they don't have the infrastructure set up to do this. And we don't want them to say they can do something, frankly, that they're not equipped to do yet.
Right. Well, great. Well, I know we're getting close to the end of our time. I want to make sure that if anyone has any other questions, they get a chance to get that in. This has been a very informative and interactive presentation. I know those are hard to do, especially on a Friday, but we are closer to happy hour. We are closer to our weekend, all of the above. So that is great. And now we're a little smarter about what resources might be out there to help us do our complex jobs. And so this is really wonderful to have you with us here today, Doug. And we will send out the PowerPoint, we'll send out all of the contact information and do some follow-up on those individual questions, make sure everybody gets what they need.
Thank you so much, Karen. Thank you so much, CPOC, and thank you to all the probation departments that allowed us some time today to share the work that we're doing. We appreciate you.